the child has been crying for more than 3 hours, for more than 3 weeks, for more than, that kind of thing. But beyond that, what are the nuances you need to know and you need to master so that you can be able to, pick up any nuanced statement? So that's why I'm bringing these things in. What is the normal crying pattern of an infant? Usually, infants cry more during the first 3 months of life, and that can be an MCQ question. In the first month, in the 6th month, when they are 1 year, when they are 2 years, when they are 3 years, when they are 5 years, and then the unprepared candidate is sitting down, not knowing what to do, right? The average crying time is between 68 to 133 minutes a day in the first 3 months of life. By weeks 10 to 12 weeks, crying reduces to about 68 minutes per day, but it can vary. So the memory aid here I want you to understand is this. Think about C for crying. C is equal to crying peaks at critical first couple of months. So always remember that, children are likely to cry more in the first 3 months of life than as they grow. As they grow, they reduce the rate at which they cry. Now, in colic, they are crying for no apparent reason. Usually, and this is what I said is very common amongst us, this one, everybody knows it. It lasts for more than 3 hours a day, for more than 3 days, more than or equal to 3 days a week in a healthy infant who is less than 3 months old. So that one, almost everyone who is preparing for MCQ1 knows these facts. But there are some other things you need to know. What are other ways colic can be presented? What are other names that colic can be presented? It can be presented as cry fast baby. So if you see that, it is still referring to colic anyway. It can also be referred to as excessive crying, unsettled infant behavior, or they even call it a period of purple crying. A period of purple crying. So if you see any of these, don't be so surprised. Now, what are the features of colic? They cry with no cause, no illness. So that is why the question was saying which of these makes the diagnosis of colic less likely. And usually you were expecting that, okay, if the child is well, then when I console the child should be able to accept the consolation, but they are inconsolable.